and the pressures in your eyes were 70 millimeters of mercury. So, you know, if you if your pressures are okay, they should be about 15, and your pressures were up at 70 with very severe inflammation in the eyes and glaucoma. And, you know, it's not an understatement to say that you were weeks away from total blindness. So it was a very, very serious situation. And um, I think what we're going to do now is talk a little bit about what it's like to go, you know, on a journey like that. And I really don't want to say too much. I'll perhaps just ask a few the pertinent questions. But Gurmit, you tell this story, you know, right from the heart. Kind of take us all through from kind of the first point at which you're hearing from me, this is pretty serious. Kind of
Yeah.
talk us through the journey.
Yeah. So if we roll it back slightly, well, literally roll it back 12 months prior to that, it was like I said, I woke up as a 15-year-old. I was doing, I think we were doing our GCSE mocks or something like that, and I think my mum was probably like, yeah, you're probably just faking it to try and get out of something like that. But I woke up bloodshot, red eyes, and at that point, obviously it was just inflammation, and I was we went to the eye hospital, and we was under the wonderful care of Phil Murray, who I regard quite highly in my life, because it's because of him is why I met you, and you know, that relationship has also grown over the years. So I spent probably the best part of a year with him, and they managed to get the inflammation down, and that was managed. But within that year, my pressures kept creeping up, and then I think it was around about, I think, the summertime, like when I turned 16, and then I think that's when Prof, you came into the picture, and I remember you put me on like steroid drops and steroid tablets, because I remember I ballooned over the summer because I could literally practically eat a whole pizza to myself. Yeah, and then it came to September, because I remember I finished my GCSEs, I started my A levels, and it was towards the end of September, and I'd come in the week before to have a full day of drops with yourself and Mark and the rest of the team. I think you thought I didn't know what I was doing, basically. So you were just there, just putting drops in my eyes all day. And then it was the week after, I remember it was yourself, Mark, I think Frida was there, and my dad was there. And so I remember having the frank conversation with you, and you literally turned around to me and just said, at that point in time, my pressures had been constantly increasing whilst the inflammation was being managed. But what you'd said to me was, no drops, no tablets or anything are working. And I remember you specifically saying, at this point in time, if we was to continue your journey, within 1 year you'd be partially blind, and in 2 years you'd be fully blind. Now, I remember one of the things that I said to you, Prof, was, will I be able to drive? Because you know how much I love my cars and stuff. And I remember you and my dad laughing and just going, there's much bigger fish to fry out there. So, you know, but as a 16-year-old kid, literally, that was my life at the time. So, but I remember you walking through the journey, and the main thing you said to me was, we want to make sure that you can maintain your independence, and that you not only you have your own way of living, and you're not reliant upon anybody else, you're not reliant upon the system, and we want to make sure that we can save and actually keep your eyesight as much as possible. So we sat down and we came up with, you informed that the only option at that current moment in time was to do the trips, and the plan at the time was, you asked me which one my weaker eye was, and that was my left eye. And so the plan was, on the 23rd of October, to come in, and we'll operate on the left eye. We'll manage that for a couple of months, and then towards the end of the year, to potentially in the new year, we'd look at doing the other eye. So I remember on the 23rd of October, we drove down like early in the morning to have the surgery, and it was eerily quiet at the time, but I remember seeing everyone in the team, and the team was great, and I think that's what was so wonderful about that time that we had with you, because it wasn't just your care that we had, it was the care from the rest of your wider team, and the fact that everyone made my family feel reassured as well. I'm going to be a father in the new year, and I can only imagine what my parents must have been thinking at that moment in time. So we went in, we had the surgery on the Monday, and that, like, I came out and I remember coming around. I remember you coming to see me and you were saying you was really brave, you was really great, everything went really well. And I remember my mum and dad being really reassured by yourself. And then the Tuesday came and everything was fine while you was monitoring me. And the Wednesday came, you checked my left eye, and the left eye was fine. I think it needed some, it needed filling. It was getting a bit squidgy and soft. But then when you checked my right eye, that pressure was at 70. And I remember specifically you saying, can you not feel anything? Which is really weird, because I remember you described it to me when I first came to you. And it was like, if you can imagine your eyeball as a football, which has drainage channels and it has constant water coming into it and it's filling up. Now, if those drainage channels are full, then that's just going to expand, and it's going to then put pressure on its biggest source, which at that time is the optic nerve, and that's where the damage comes. So I remember specifically you saying that to me. And so the words that you said to me was, if we don't operate on that eye, that's gone. And so I remember we went back and you obviously you did what you needed to do to get me into surgery, because obviously the plan was not for me to go into surgery that day. And I remember my dad was supposed to go off to go and do an afternoon shift, and he left, and then I think he was prepping me for surgery, and then within half an hour my dad came back, and I said to Dad, I was like, what are you doing? I was like, it's just a routine surgery, you know what? And he's just like, I can't do it. I can't see you go through this on your own. And so I remember going into surgery, and I remember that day on the bed going into the theatre, and they were talking about, I think it was Marvel or something like that. They were talking about a film, and like I was out like a light. And then the next thing that I remember is, I don't even remember opening my eyes. I actually just remember it just being dark, because I did actually have 2 patches over my eyes at that time. And I have a picture somewhere which I do need to dig out, because I'm sure even my wife wants to see it as well. And I think it was only at that moment in time where I didn't have the ability to even just go to the bathroom. My dad had to take me to the bathroom at that time, where it sort of really sunk in to say, this could be something really serious. And I think that was one of the points where I really appreciated not only how great my eyes were, but the fact that I had you in my life and your team that was around me to actually bring me to this point, and to do whatever you could in your power to actually make me better. And I remember having to, like, in the middle of the night, having to have patches and have the pred gels in my eyes and everything, and it was quite something. And then Friday everything was Thursday everything was fine, and then Friday when I woke up, me and Mark was having a bit of a play around and stuff, and then I remember I'd ate some fruit and stuff in the morning, and Mark checked my right eye, and again, that was a bit squidgy. It needed some gel and stuff in it. And he was like, just tell Prof you haven't eaten. And I was like, I can't tell Prof, of all people. I was like, oh, you better not. I'm a 16-year-old lad here. But you're telling me this, you're going to tell me to lie to him. And so we had to have that. Obviously, I then had to go back into surgery on the Friday to have the gel put in. And I remember you specifically saying to me that it's a 15-minute procedure. You'll be in and out. And I remember having my eyelids clamped wide open, and it was about 45 minutes later, and you put an injection into my eye, and the pain, because I've got fillings on this side, I remember the pain coming right down my face and into my jaw. I remember saying to you, Prof, I'm sure you said this is going to be 15 minutes max. So yeah, I think, but like by that time, and I think thankfully from there, everything has been good, touch wood and all that. And I remember you saying you might have some scar tissue and some follow-up surgeries, but thankfully it's 18 years later, and at that point you managed to save my optic nerve and my sight, so I've never had any loss in my vision, and it's only because of yourself, Phil Murray, the rest of the team that was around me, is why I'm here to tell this story today, and I'm eternally grateful for you, and so my family are as well.
Well, that story, it's hard to hear even now. It's tough for a young man to have to go through that. And just to let the audience know that Gurmit now, from my perspective, 18 years down the line, has two perfect trabeculectomies, which are working great. His pressures are better than mine and Frida's and Mark's. The pressures are 10 in each eye. He has no inflammation, no cataract, and he can read down to the bottom of the line of the chart. I mean, it's exceptional. I think you have multiple people watching over you, I suspect, and we've been blessed to be able to help you as well. So that is a great description of what it's like to go through major surgery where there is uncertainty. The younger you are, the post-op course can be a little bit kind of rocky and stormy for a week or two, and you have to, with your team, you have to get through that stormy period. And then, as you say, things kind of become more plain sailing, don't they, there? Um, as someone who has kind of stood on the edge of the abyss and had to think about blindness, what would you share about the kind of things that helped you get through that worry, that normal kind of worry that what's going to happen to me?
I've so I've always been a man of faith, and like I said, even at that time, I knew there was an alignment for some reason, and I knew one of the only things that really got me through at that time was we really did not have any of the option. We'd exhausted all the options beforehand, so I had no other choice. So it was either I tell myself this is the choice that's going to happen, and if that happens, then so be it, and I will live my life as it is. And if that's what's bestowed upon me and that's how my life is supposed to be, and then so be it, because I'm eternally grateful to be in this position as I am. And there was a lot of fear. Like I said, my main worry at that time was potentially, will I be able to drive? Will I be able to work on cars? Will I be able to do all the normal things that what a normal person would be? And thankfully, I think because I've got a large family, as you know, Prof. My dad's one of 8, so there's quite a few of us around. But at the same time, so they were always around me, and they never felt like I was alone. And especially, but it wasn't just my family; it was also you and your team as well, because at that time, they're the ones who would come and check up on us. They're the ones who would come and do majority of the work. And I think the nail in the coffin for us was the fact that we'd done the 2 surgeries. It was a really long day, and you waited till I came round towards the end of the night to come and see us, and that really showed how much it wasn't just us that was going through the journey. You were going through it with us, and that really helped us get through it as well. So, and it was the support that you provided and the support that the team provided, which really helped us manage it on a day-to-day. And I've always been a person that says take every day as it comes, because every day is a blessing. Nothing is promised. So the fact that I'm now 18 years later and I can still see the wonderful things that I have seen in this life is a testament to the work that you and your team have done.
Yeah, and you're going to see a very wonderful thing in the near future, which will be very little and make
Yeah.
a lot of noise probably. And that's another blessing in life, isn't it? When that happens. So I think that's kind of really told the story well. And maybe we could now, kind of open it up to Conchita and Robin and say we could map the journey, the day 1, week 1, as things go on, and some of the questions. So maybe I could start it off by saying, how do you manage with all the drops post-op? Because it needs a lot of treatment post-op to suppress inflammation, stop infection, all that kind of stuff. How did you manage in the early post-op period?
So obviously the first week I was still in hospital. So I had lovely nurses come round and put patches on my eyes and put the pred and the gel in your eyes, which is a nightmare, and it makes your eyes sticky. It's like you've got conjunctivitis all night. Actually, there's a question for you there, Prof. You made sure, even months down the line when I was at home, I had patches over my eyes. But I don't think anybody, you probably did at the time, but bear in mind I was 16 and I have slept since. Why did you do that, and why was it so important for that to be, and that regimen to be obviously I had to fulfill the drops every single day, but
Yeah.
then the patches as well on top.
That's a really good question, Gurmit. And obviously, the drops, have these roles to suppress inflammation, stop infection, and stuff. So that it's easy to understand that. And what we do is that these little clear shields, or sometimes they're white shields, are called cartellas, and they're made of plastic, and they kind of vaguely conform to the shape of the eye socket. And what we ask people to do is put the cartella, the shield, on at night. Usually it takes about 3 pieces of tape to get it on. And the reason for that is that, well, several reasons. The night is a dangerous time. And, first of all, you might accidentally rub the eye at night and break the little stitches, and that would change the whole flow of the trabeculectomy, which would be a bit of a disaster. Or you might sleep face down in the pillow by accident and squish the eye, and again, alter the valve. I've even had somebody, thankfully, she was wearing a shield, whose husband turned over in the middle of the night and accidentally whacked her in the head, and without the shield, the eye would probably have been lost. So we do actually keep that shield going for a good 6 to 8 weeks until the trabeculectomy is perfectly functioning, pressure's beautifully stable, healing is finished, um, and there's really no major risk then of damaging the eye.
Okay, lovely. Yeah. Okay. Thanks for that. That really helps. Yeah. So then my management of it, it was, so I was at a time where, as a 16-year-old, I wanted to take a bit of control in my life. And my parents have done a wonderful job up until that age. And they still do a wonderful job now. But I was at a point where I wanted to actually take control of it. So I was the one who managed the collection. Managed to make sure that we got my drops in time, made sure that I had a strict schedule of when they went in and when they weren't in. And I think also, I think it was at that time where you really told me the importance of how to put in drops. And I think that's quite, because I think prior to that, everyone just thinks you open your eye, you put a drop in. But then you also then said we need to press alongside. I don't know whether that was a new practice which came in at that time, but it was to press alongside the corners. Maybe it's worthwhile just informing people who are on the call to just say why that is so important as well.
Yeah. So a couple of things with drop technique, especially when you're post-op, where you don't want to get any infection. Infection can come from hands. Let's say if you touched a dirty doorknob or something. So you're washing your hands first, and the idea is that you're keeping everything nice and sterile. So let's just say you've got a drop of Pred Fort, the anti-inflammatory. You're going to maybe have a little Tupperware, little container that you have to drop in, and you take the cap off, and then you're going to actually shake it first in case the droplets settle out. Just give it a good shake. And then you're going to apply it into the kind of outer third of the eye. You make a little pocket by pulling the lower lid down. It's in the outer third, because the drain into the nose from the surface of the eye, so you wouldn't want to put it directly in the corner because it might go down the nose quite quickly. So you pull the eye down, you pop one drop in, and then recap it. Now, in the very early post-op period, it's a bit sore and stuff, so we don't get people to press in the corner, in the first week or two. But after that, we get them to use the pulp of their finger, not touching the eye, but just right in the corner where that little knotty lump is, which is the tear passage next to the nose. And by pressing on that, the drop stays in the eye and doesn't go straight down the nose into the mouth, where it wouldn't be doing much good.
Yeah.
So you're absolutely spot on, Gurmit, that if you're going to put drops in your eyes, you want to get the best out of them and the least side effects. Because let's just turn it now to glaucoma drops. You want the glaucoma drop in your eye. You don't want it in your nose where it gets absorbed into the body, and then it might affect the heart or the lungs or something else, because these are powerful drugs. So that's a really kind of great question for this stage of the journey.
Yeah. So and then thank you for that. That I think that really opens my eyes to it as well, because it's been so long since I've done that, and thankfully I don't have to put any drops in now. So that's really reassuring. That is. So yeah, so across the first year was, I think, where I had the mass amount of the actual drops and the management of my post-operative journey. And then I think I was on Pred Fort for about 6 or 7 years after that, and it was a reduction in that across the years, and that was managed by yourself and Prof Murray as
Prof
well.
Murray, the chief of inflammation.
Yeah.
So again, this would be quite interesting for you, Gurmit. Like a very standard trabeculectomy on a very straightforward eye, let's say an eye that just had primary open angle glaucoma and no other problems, we'd be able to get the steroids, the Predfort or whatever, weaned out pretty much by 8 weeks, very occasionally 12 weeks if the eye was a little bit slow to settle. So it gives you an idea that when you have a secondary glaucoma, where there's other causes driving the problem, like inflammation, obviously, yeah, the steroids then may be a much slower tail off.
Yeah, yeah, yeah. And then I think following that tail off, I have now, I genuinely can't remember how long it's been. It's definitely been over 10 years. It's probably getting closer to about 13, 14 years since I've not actually had any drops, any other management that's been required. And yeah, I'm sort of thankful that I don't have to be honest with you, because I know how difficult it is, and how much of a strain and of a stress that can be at times as well, because you want to make sure that you're giving your body the best fighting chance as well, because I think it's only until you put yourself within that situation of physically blocking out your sight for a significant period of time do you realize how precious it is. And it's something that I've tried to say to you over the years, even to Joe over the years. Let's get a lot more knowledge and information out there, especially to younger kids, even if it's a session of like 1 hour across the year at the school, and their eyes are blacked out and they've got to actually experience as to what would happen should anything happen with their sight. And I think that would be such a powerful message for people out there.
I'm with you 100%. As you know, Gurmit, in a slightly different field, Frida and I have done a lot of work in children's eye trauma. Do you know that every year in the world, 1 million children get a major eye injury? Some of which ends up in glaucoma, as you can imagine.
Yeah.
And, we've done a lot of work to try and reduce the number of eye injuries that occur globally, and actually making fantastic progress. But anything that you invest in a child's education is going to come through, isn't it, in adult life? So
Yeah.
I'm 100% with you on that one.
Yeah, I agree.
I just noticed the lovely Conchita's joined us. Conchita, have you got any questions you'd like to put our way? I think your mic might just be muted.
It's been really interesting listening to the journey, and I feel privileged kind of like hearing how Gurmit's journey. So that has been really good. I mean, we've got a lot of questions in the chat. So is it okay for me to ask a few questions that come in?
Yeah, of course, and we'll do our best between us to answer them.
Right. So one of them, it says, if the trab fails, are there any other options?
So very straightforward question and very straightforward answer. Yes. I mean, as a surgeon, you never give up. Never. Now, trabeculectomy is, relatively far along the journey on the serious end of glaucoma. But were a trabeculectomy to fail, you have numerous options still in front of you. You can resurrect most trabeculectomies if they do scar up a bit by doing a special, very relatively simple procedure. You can repeat trabeculectomy. There are other tube operations. I would say if a trabeculectomy is not working optimally, there's still a huge amount you can do to get it back to working well.
That's really reassuring. I'm sure people find that reassuring. So some people have said that they've had a trab and then since developed a cataract. Is there anything that they need to be aware of in that respect?
Very good question. So cataract surgery in the modern era has become, relatively straightforward with a kind of 98, 99 chance of success, which is incredible when you think that you're going inside the eye, behind the pupil to get the cataract out. Now, when you do that, even on a normal eye, it creates a little bit of inflammation. And that inflammation, when you have a trabeculectomy there, can cause the trabeculectomy to scar. So when we do cataract surgery in people with a trabeculectomy, we take special measures to try and ensure that the trabeculectomy drainage site, which is called a bleb, which is under the top eyelid, we have to take special measures to try and make sure the bleb keeps functioning. We can use anti-scarring therapy at the time of surgery, and we can use more steroid eye drops afterwards for longer to really keep the inflammation suppressed.
Thank you for that. That's really interesting. And actually, that leads me on to another question, actually. So how long would a trabeculectomy last? I mean, generally, I mean, obviously, Gurmit's, obviously, Kate, I mean, I'm guessing it depends, but obviously, I'm not the expert. So what would you say?
It's a really good question. And the answer depends entirely on two things. Number one, the type of glaucoma. So certain types of glaucoma, the body makes much more scar tissue, and there's a higher chance of a trabeculectomy not working as well with time. And also the surgery, is it a perfect operation where everything's perfect, or were there a few technical issues? Was there a lot of scarring or technical problems? So it's the balance between the type of glaucoma and how good the surgery was in the early stages determines. But it is perfectly possible to have trabeculectomy, and we have a great number of trabeculectomies working 10, 15, 20, 25, even 30 years down the line. I think the oldest trabeculectomy that I've that I've done is about 35 years old.
That's
so,
really...
it can last a long time.
That's really amazing, actually. It'd be drawing its pension soon. So are they needed more for people with normal tension glaucoma than maybe with high pressure? Is there a correlation or a difference?
Yeah, great question. Great question again. These are a little bit complex questions, because let's say if you just compared primary open angle glaucoma with NTG, it all depends on the rate of progression, the rate of damage. So either group could need trabeculectomy. But as a general rule, patients with normal tension glaucoma need lower target intraocular pressures, and therefore operations like trabeculectomy, which create lower pressures, Gurmit's pressures at 10 in each eye, are often needed.
That does make sense. So we've got a bit of a lifestyle one here. So how long after surgery do you advise exercise, like maybe running or swimming? And can you ever do yoga after having surgery?
Really, really good questions again. So let's just do swimming first. There are two things that you don't want to happen in the early post-op period. You don't want to get infection in your eye, because you can imagine the eye's recently been operated. That would be a disaster. So you wouldn't want to go hugging somebody who's got a stinking cold. That would be a really good way of damaging your operation. You don't want to rub the eye if it gets a little bit itchy. Be a really good way of damaging the operation. You don't want to lift something really heavy and strain yourself, because you can feel it in the eye. You can damage the operation. Now, specifically with what you asked me with swimming, swimming pools vary in how clean they are, and there are in some pools a lot of bacteria. I mean, really quite a number. So my advice, if I needed a trabeculectomy, who knows, you could do, you never can predict the future. I probably wouldn't swim myself ever again if I'd had a trabeculectomy, okay? Because I just wouldn't want to take the chance of getting an infection. Another viewpoint would be to say, by about 4 months after the trabeculectomy, it's as safe as it's going to be. So then you can swim, but you need to realize there's a small risk of a serious infection. So we never try to be prescriptive with patients, because that's unfair. Everyone's got a different life, but we say, well, this is the risk. You have to judge how important swimming is to you. Certainly running, going to the gym, all that's fine once you get to about 3-4 months post-op, no problems at all. Yoga, brilliant, but we don't like inversion. So there are certain positions like down dog where your head is down for a prolonged period below your waist. After a trabeculectomy, we don't really like that at any stage. So you have to modify your yoga, but support yoga 110% and Pilates, fantastic.
Perfect. Yeah. I mean, I guess it depends on people's lifestyles and how they, but yeah, absolutely. It's about living your life as well, isn't it? Making the best of your life.
But the idea of surgery is to get you back to normal life.
Exactly.
Really.
Yeah. So it's going to be normal-ish, I'm guessing. So is there a kind of like a different kind of anesthetic when you're having a trabeculectomy to maybe having another eye op? Gurmit talked about obviously having general anesthetic. I mean, so is it always under general?
No, I mean, we're very lucky. Again, it depends on how good your anaesthetist is. I was blessed to have the world's best anaesthetist for all of my surgical career. So like you could get glaucoma on the first day of life. I started off doing children's glaucoma on babies, 1 day old, 7 days old, obviously general anesthesia. Again, throughout childhood and often young adulthood, patients do better with general anesthesia. But then as we get a bit older as adults, we have the option to do sedation and local anesthesia, and various types of local anesthesia. So it doesn't have to be general, as an adult. It depends a little bit on patient preference and surgeon preference and technical difficulty.
So there's another one as well. How do you decide if you need a trab rather than just kind of giving another drop to sort of lower the pressure? I mean, when do you make that decision to sort of like maybe go with kind of a procedure rather than just doing it by drops?
Again, fantastic question. So let's talk about medicine laser surgery, the standard paradigm, which tends to escalate. The risk of having a serious problem from a drop, probably about 1 in 2 or 300. So it's very small. Then you move to things like laser, selective laser trabeculoplasty. I specialize in laser, and I really, I've done a lot of work to make laser safe. And you should have a complication rate of probably less than 1 in 1,000 for, SLT laser. But then, let's say if you've had medicine, you've had laser, but your glaucoma is progressing and getting worse at a rate that is going to impact on your life. Maybe you might lose your driving license or your ability to be a mechanic. When we've got glaucoma progression that is threatening vision, that's when we move into the surgical zone where you're not looking at complications of 1 in 1,000 now. You might be looking at serious complications of 1 in 50. It's a lot. It's a big jump, isn't it? And so you then have to balance, okay, we've got a 1 in 50 risk of surgery. What is the risk of this glaucoma progressing and taking faculties away and taking quality of life away from people? And you have to balance that.
Yeah, I mean, that does make sense. I have another question about pressor flow. So say sometimes a trab is compared to a pressor flow. I mean, what is a pressor flow?
A pressor flow is a short tube. If I had it in my hand, it would be about as long as an old half penny piece. It's about 7-8 millimeters long, very thin. And it's a very, very similar operation to trabeculectomy, except in trabeculectomy, you hand cut the valve where the fluid's going to drain. In a pressor flow, you put this artificial tube into the eye, which acts as the drain. Otherwise, every other aspect of the operation quite similar, really. So they're both good operations. They have slightly different indications and need slightly different post-op management. But pressor flow is a new and good technology.
Yeah, I mean that's good. We've had one here about would you require the patient not to use maybe the pressure reducing drops in the morning of the procedures? Would it make any difference if they put their drop in that morning or not?
Good question. I think a very good rule of thumb on the day of surgery: do everything that you do as normal. Take your drops as normal. Take your tablets as normal. Unless the surgeon has told you not to, because you don't want to be operating on an eye which has got a higher pressure. You quite want the pressure to be, as good as it can be when you open the eye.
Yeah, I guess you're kind of making it the best possible before, yeah, and that totally makes sense actually. We're going to go back to the kind of like the, I suppose, lifestyle. We talked about swimming and about, you know, possibly being okay. Someone said about swimming goggles. Are they maybe advised to keep the risk of infection? I mean, obviously they can be also quite tight fitting. That also will affect the eye pressure. So what's your
It
stance,
is.
or what do you
It's
think?
a very complex area, this. So I have had the odd pro swimmer that I've had to operate on. Goggles are good, but you do still get water. And we've all worn goggles. You still get water in your eyes, don't you? But you just get much less water in your eyes. The problem with goggles is they exert a negative suction on the eye. And there is some evidence that that's not great for the bleb. There's not enough evidence to really guide people on this, but certainly I wouldn't wear goggles in the early post-operative stage, say in the first 2, 3, 4 months.
Yeah, I mean that when those couple of those early stages sounds like really kind of like a really careful time. You've got to make sure that obviously everything is healing and everything. So that's, you've got to nurse those things through. Absolutely. How do you
Conchita,
stop?
can I give you a
Yes,
little example
absolutely.
of how,
Yes,
sometimes
please.
life gets in the way of that though. So I had a lady that I had to do a really, really high risk operation on, a really high risk trabeculectomy once on a good eye. And she was very sensible. And we said to her all the usual stuff, no heavy lifting, please. And she did perfectly from surgery. And about 4 weeks post-op, someone fell down on the pavement, when she was out shopping. A really big person that weighed like 19, 20 stones. And she's a lovely lady. And she tried to help get this person up and actually did quite a bit of damage to her trabeculectomy, which thankfully settled and she was fine. But it really got our hearts racing because what it does when you strain that part is it forces loads of fluid through the trabeculectomy, through the valve, and changes the pressure, the setting of the valve. And sometimes you can let too much fluid out.
That's really hard, isn't it? Because obviously if you're a helpful person, you can't let that happen. So it's about kind of, absolutely. Before I'm going to have a break in the questions, I have to say, someone said, thank you, Gurmit, for sharing your story. Very inspiring and a great role model. So, and what resilience. I just wanted to share that. Isn't that lovely? So, and I totally agree. So, yeah, perfect. How do you stop scarring? Obviously, because it's all about the scarring, isn't it? So obviously, people say that they scar, and that obviously can affect the bleb. And do the anti-scarring medications really work?
Yes. So the gold standard for trabeculectomy is called trabeculectomy plus anti-scarring mitomycin C. And with that combination, you can have a 95% to 97% chance of success. In the old days, before we had mitomycin, if you were to go back to the late 80s, and maybe you're on 3 glaucoma drops, you had a 50% chance of your trabeculectomy failing. So these anti-scarring agents made a massive difference. They're difficult to use. They require a lot of experience, a lot of nuanced surgical application, but they're brilliant. And so anti-scarring therapy is just mandatory. Yeah.
That's amazing. That's almost, you almost doubled your success rate by just
Yeah.
using those products. That's pretty amazing. I've got one. So often people experience worse vision shortly after the trab. I mean, how long might that take for things to settle down and kind of like having their vision return to kind of normal?
I might start by getting Gurmit to answer that. Real life Gurmit, give us a bit of a feel. Bearing in mind you were quite a complex case, but give us a feel.
Well, probably it's probably a good couple of weeks, to be honest with you, and that's purely because the amount of drops that are going in and out of your eyes at time as well, and the pred gel is just ridiculous. It just clamps your eyes shut, and and that just makes it's like you've permanently got Vaseline in your eyes. Basically, that's the only way I can describe it. It's like having Vaseline in your eyes. But yeah, I would say it was a good couple of weeks until my vision actually settled, and actually then I had to properly start wearing my glasses seriously, and yeah. I don't know whether that was profs doing or anything, but yeah. So yeah,
well, I think that's a great answer. I mean, I would say the same. I mean, I'd say a couple of weeks, 3 weeks, your vision should be settling quite nicely. Depends what post-op drops you use. And we usually say to people say, after a trabeculectomy, when can I get a new pair of glasses? When should I go and get checked? And we usually say, well, you want the valve to be really functioning well and stable. So don't spend a lot of money on a new pair of glasses for 3 to 4 months after the trabeculectomy. And then, that's a good time to change things.
That's quite a long time, isn't it? I'm talking about kind of like, so can people, sorry, I'm just going to say, can people do anything to help their vision becoming blurry or being blurry?
No.
No.
No, it really is how quickly does your operation settle down? You might be really lucky and it settles down in a week or two, or your operation might take 6 to 8 weeks, and you can't rush it. Everybody heals at a different rate. You can wear your old glasses, and the glasses don't often change much, but it is difficult for a few weeks. It is. And if you have to have both eyes operated on sequentially, you need a lot of help around the house, and you need to be off work and stuff.
Well, that takes me to the next question, actually. So how long would you need to have off work before, afterwards?
Depends on your job. So if your job was in the military, you might have to take 3 months off, carrying heavy loads, guns, and all that kind of stuff. If you were a fighter pilot, same, because you've got to have perfect vision before you can get back to the job. If you were cleaning the bins out, dustbin man, again, probably 3 months, because you can't afford to get infection in there. Let's say if you had an office job, you could probably get graduated return to work after about 4 weeks. One thing that's quite important in trabeculectomy is you mustn't spend too much time looking down. Imagine I've got a little book here on my desk, and imagine if I was looking down all the time. What you're doing is stretching the stitches under the top lid if you're looking down for prolonged periods of time, and that can alter the pressure in the valve. So we don't like that in the first 3 or 4 weeks, and it is hard to reduce your reading and not do so much reading. The flip side is, as Gurmit will show you, you might get the next 20 years with not a problem. So it's not that we say you can't read, but if you do read and you get into trouble, it's your own valves that are going to suffer.
Yeah, absolutely. This is one it's kind of, I suppose, a bit of lifestyle, but it's about kind of pressure. But if you have constipation, obviously that's kind of quite a natural thing in our lives, and especially when you've gone through trauma. How does that affect kind of eye pressure and maybe the trab healing? Because obviously
that is a superb question, and the reason it's superb is that if you get this right, you can stop a really serious complication. So the problem with constipation, which is very common, is that people have to strain, and for prolonged and really strain, and that can cause a bleed inside the eye when you've had a trabeculectomy. And so if you know you're a little bit prone to constipation, or if in the early post-op stage you're thinking, I'm running into trouble, get early help. Go and see, I know it's difficult to see GPs and stuff, but get the laxatives that you need and all the stuff that help prevent constipation. So if you can prevent it, it's best. And if you get it, get onto it early. And as best possible, try not to really strain.
Yeah, I can imagine it's going to be hard. So is the trab done when you need to anaesthetize the eye? Obviously, if it's done, would it done by an anaesthetic injection or drops?
Trabeculectomy tends to be a slightly larger operation, and you need to do certain things like diathermy the eye and cut into it, which is a bit more painful. So you need a good, if you're under local anaesthesia, you need a good local anaesthetic block. So it wouldn't generally be done with drops alone. However, there are certain techniques where you use anaesthetic drops combined with certain injections to do a trabeculectomy.
Thank you. And we talked about obviously the trabeculectomy to kind of reducing the pressure in the eyes. Is there a normal pressure range for a few years after trab, or is it the same as without a trab? Does it have its own little range itself, or?
Yeah, it's a really good question. In fact, that I love that question because it's something I'm particularly interested in. You probably know this, but when you have glaucoma, depending on the type of glaucoma, your pressure can vary by up to 8 or 10 points in a day. It's a huge variation. And what I found after a good trabeculectomy is that you flatline your pressure 10, 11, 9, 10, 10, 10. It's just beautiful. And I think that getting rid of those spikes is really good for the eye. And there's a bit of emerging evidence around that.
It's quite interesting. I mean, I don't remember when this was but someone's asked, what does this sequential mean? And I can't remember whether you mentioned that as a terminology or not. So I apologise for.
Yeah, so sequential means sequence in order. So let's say if you had early glaucoma, you might have drops. The next thing in order, in sequence, might be laser. The next thing in sequence, in order, might be an operation. Just means progression through time.
Yeah, that makes sense. I'm just thinking, right, we're probably almost towards the end, but I've just a couple of things that people have just been saying thank you very much, and someone has years of glaucoma, and they've had a great team. They feel like really embrace that this trabeculectomy is working for them, so that's really positive. They're saying thank you. And this one it's a bit of a strange one. It says, would you recommend trabeculectomy to encourage people to bend the knees rather than bend forward to preserve back health? I think that's a bit of a extreme.
Yeah. It's quite a clever. I like the thinking behind it, though, because what I find is the reason why I invest so much time in educating patients is they get better results, and we all want these operations to work. So let's say if you did drop something on the floor, it probably is better to bend your knees and keep your head above your waist than flip your head down below your waist. So, it's quite a good question, really. And yes, if it's practical.
Perfect. So I think we've pretty much got to the end of the question. So I'm just going to start sharing the screen about when people want to go for help. But thank you very much for taking time out.
Conchita, would you mind if I just ask Gurmit? Because I feel that.
Oh, please
that
do.
I'd love to.
Please
I just want to hear Gurmit's voice again because he's an inspiration to me.
Yes.
And I'm trying to think of Gurmit, if you could teach children, because you're going to become a father, if you could teach children one thing about glaucoma in the eyes, if our Prime Minister gave you the budget to do it, what would you do?
It's like I alluded to earlier, Prof, it's that early education. So whether it's once in a school calendar year where the kids are literally in a room and you blank their eyes out, and that, I know it sounds extreme, and I'm not saying physically blank their eyes out, obviously get them to wear eye masks and whatnot, but get them to experience how important and how precious your sight actually is. And that's just general eye care, and then to provide a little bit more information about glaucoma. As a 15-year-old, when it was explained to me, I only knew about glaucoma purely because of my grandmother. My grandmother had it because of diabetes, and I was not aware of the fact that, even now speaking to Joe at the Children's, that kids are born with this, so that general knowledge, and it is general knowledge in itself, because when I was at school, the only time we did about the eye was a single page in biology up until my GCSEs, and it was a small little section. That's your eye, that's your iris, and that's your lens, and that's it. Nobody else spoke about it, and it's only because of this journey is obviously why I now have a greater knowledge of it. But for me, that is like quintessential for the knowledge of, and if you like you said before, if you empower the children who have come through, you'll have better eye care and you'll have better support as well, and a better understanding from people as well, because it's one of those conditions where people are like, you look fine, and I was like, I may look fine as it is, but I'm definitely not. And even to that point when my pressures were at 70 odd, and I remember my cousin saying, can you not feel anything? I really can't feel anything. It's really strange as it is. And then to have somebody say to you, yeah, you're practically going to lose that eye. So just that general knowledge and that insight into people. And I think that will then allow people to be a lot more compassionate about the condition as well, and to allow people to support you a little bit better, and to understand like the simple thing of just bending down to pick something up. It's sort of like like my wife's pregnant now, and it's difficult for her to bend down, but she can physically see that. Whereas somebody with an eye condition, especially glaucoma, you wouldn't obviously know that. So, yeah, ram it down the kids' throats, basically.
No.
If anyone can persuade our Prime Minister Gurmit, you're my man on this one, together with Glaucoma UK. So I just want to say thanks for inviting me to speak, and it's been really great.
Thank you, and I wish we could definitely bottle that up, and that would be brilliant. I mean, I think if everybody had that, then we might, you know, our aim is to stop people losing sight for glaucoma. So if everybody had that kind of vision, and you know, made sure it happened, then we would be out of a job. So that would be good. I'm just going to launch a quick poll if I can work out where my meeting. I've lost my. There we go. I've managed to lose my. Let me just stop sharing and then that's it. Go right. I'm going to launch the poll, and to see where we've got to. Right, there we go. And while I'm launching that, I'm going to share the screen, and it'll be our helpline on there. If you need any kind of any questions, then please kind of make sure the helpline, give them a call, and we will. Let me see. Actually, while we're waiting that, one for Gurmit actually is, do you notice your trab at all now? Do you feel it?
I don't feel it, no, but I like showing it off when I possibly can, if that makes sense.
It's like your party trick.
Yeah, it is. Have a look at this. But yeah, and it's one of those which is it's very interesting to see. I know people are quite squeamish with those kind of things, so I'm very mindful of that as well. But it's a part of me, and it's battle scars more than anything, and that's why I'm very open to talking about it, and because it's sort of one of the reasons why I am like I am, whether that be a great thing or a bad thing. But you know, it's a wonderful thing to show, and it's an interesting party piece. Let's put it that way.
No, that's thank you. That's really interesting actually. So thank you all, and just want to say one more thing, that this is for the people attending the webinar. If you think that you can have a fantastic service from your team at your local hospital, then please do nominate them for the Excellence in Glaucoma Care Award. When you finish, you'll get an email from us post-webinar with all the details on there. So if you want to do that, then I'm sure your consultants and glaucoma team will be really grateful. But I would like to say thank you very much to you two gentlemen. It's been an absolute pleasure, and I've really, really enjoyed you joining us this evening. So thank you very much.
Thank you very much for having us.